The Unraveling of Ramsay Clinic Thirroul, a cautionary tale of unmet promises and a crumbling mental health care system. The whispers started subtly, then grew into a roar. The resignation of trauma specialists from Ramsay Clinic Thirroul, a facility once hailed as a beacon of hope for women grappling with trauma, paints a stark picture of the escalating crisis in Australia's mental health care system. This isn't just an isolated incident. It's a symptom of a deeper, more systemic failure. In 2022, Ramsay Healthcare proudly unveiled Australia's first women's-only hospital in Wollongong, a facility explicitly dedicated to addressing trauma-related mental health issues. Ramsay Clinic Thirroul was positioned as a game-changer, a sanctuary where women, often survivors of unimaginable horrors like family and sexual violence, could finally escape the relentless cycle of fight or flight and begin their arduous journey to recovery. The promise was clear: a specialized therapeutic environment tailored to their unique needs, offering a pathway to healing. But the reality, sadly, has fallen far short of the ambitious vision. The clinic, once a specialized haven, has been transformed into a general female-only psychiatric unit. This shift, while seemingly subtle on the surface, represents a devastating blow to the women who desperately need the specialized trauma-informed care it was initially designed to provide. The transition mirrors a broader trend within the Ramsay system, reflecting a growing reliance on public-private partnerships to address the overwhelming demand for mental health services. The clinic's transformation coincides with a mass exodus of psychiatrists from the NSW public sector, forcing the state government to increasingly rely on private facilities like Ramsay to absorb the overflow of patients. This influx of patients, while intended to alleviate the strain on the public system, has inadvertently diluted the specialized care once offered at Thirroul. The clinic, now operating under a public-private contract with NSW Health, finds itself grappling with the weight of a system teetering on the brink of collapse. NSW Mental Health Minister Rose Jackson acknowledged the shift in Thirroul's focus during a parliamentary session on March 27, 2024, confirming the loss of specialized trauma care in response to questions from Dr. Amanda Cohn, the NSW Greens mental health spokesperson. This official confirmation underscored the growing public concern and frustration surrounding the situation. The silence surrounding the reasons behind the mass resignation of the trauma specialists adds another layer of unease, leaving many to question the underlying factors contributing to this alarming development. The October 2023 submission to the NSW Special Commission of Inquiry into Healthcare Funding by Ramsay Healthcare Australia's Chief Policy Officer provides a glimpse into the broader strategic considerations at play. The submission explicitly advocates for increased government partnerships with the private sector, highlighting the private system's purported capacity to address critical healthcare challenges, including the burgeoning mental health crisis and the backlog of elective surgeries. This proposition, while seemingly logical on the surface, raises critical questions about the potential trade-offs between profitability and patient care when the private sector takes on such a significant role in the delivery of essential services. The situation at Ramsay Clinic Thirroul serves as a stark reminder of the precarious state of Australia's mental health care system. The unmet promises, the resignation of specialized staff, and the systemic pressures forcing a shift away from specialized trauma care represent a collective failure. It's a cautionary tale, highlighting the need for urgent reform, increased investment, and a renewed commitment to ensuring access to quality, specialized mental health care for all those who desperately need it. The women of Wollongong and countless others across NSW deserve better. The system has failed them, and the consequences are far-reaching and devastating. The silence surrounding the specialist's departure must be broken, transparency demanded, and systemic change implemented. The future of mental health care in NSW hinges on it. The women who sought refuge at Ramsay Clinic Thirroul deserve justice, not just empty promises and a compromised system. The focus must shift from convenient solutions to a holistic, sustainable approach that prioritizes patient well-being above all else. This isn't merely about numbers. It's about lives shattered and futures hanging in the balance. The crisis demands immediate and comprehensive action, not just reactive measures. The women affected deserve more than just a general psychiatric unit. They deserve the specialized trauma care they were promised, and the system owes them a profound apology and a concrete plan for redress. The future of mental health care must be built on trust, transparency, and an unwavering commitment to delivering the care everyone deserves. The current system has clearly failed, and the consequences are devastating.